Namaste and good afternoon. Welcome to the Cancer is Conquerable series presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I do hope that you've all been keeping well and safe. Lack of awareness, lack of reliable information, and fear of disease, in my opinion, are the three most important causes why people delay seeking treatment. It then gets too late to successfully treat diseases that could have been even cured if detected and treated earlier. A perfect example of such a disease is cancer. We fervently wish that it doesn't happen to us or our loved ones. Then we tend to avoid what scares us. But what we need to do is actually just the opposite. We need to learn all about cancer, what its risks are, what our risks are, what the earliest signs are, what to do if diagnosed with it. And with these weapons, it becomes a war that is much easier to win. So, what is cancer? We are made up of trillions of cells that over our lifetime grow, divide, and die. But cancer starts when these cells start dividing controllably, and become abnormal, and then start crowding out the healthy cells. There are many types of cancer. Cancer can develop anywhere in the body. But today, we are going to start with one of the most common types of cancer, breast cancer. It is the most common cancer in women in India. 27.7% of all new cancers detected in women in India in the year 2018 were breast cancers, according to a study. And there are many such facts and figures, how in urban areas it has overtaken the cancer of the cervix and so on and so forth. But really what you need to know is that breast cancer is a real possibility. It is an alarming there is an alarming increasing trend all over India. But the comforting news is that deaths due to breast cancer can be definitely reduced, but that can be done and only be done by being aware, alert, and screening for it early. So let us find out all about breast cancer, particularly related to the risk factors and screening mechanisms. And I am delighted and privileged to welcome Dr. Bhawna Sirohi, Lead Medical Oncologist, Apollo Proton Cancer Center, Chennai. Dr. Bhawna Sirohi has exemplary experience of more than 25 years. She's a renowned senior consultant across the globe who specializes in treating breast oncology and gastrointestinal cancers. She has worked with top oncology centers and oncologists across the world, and her expertise extends, as I said, to breast cancer and also to colorectal, pancreatic, gallbladder, neuroendocrine, stomach, and hepatocellular and other types of cancers. She completed her MBBS and her DCH in LLRM Medical College, Meerut, and then her FRCP from London, and then oncology training at the Tata Memorial Hospital, Mumbai, and the Royal Marsden NHS Foundation Trust, London. Her professional work is very wide, and she's been lead medical oncologist over many leading medical institutions in India. FNHS consultant in Barts Health NHS Trust, London, was a director for the Pan Thames Educational Program, was a consultant medical oncologist in Tata Memorial Centre, in private practice in Leaders in Oncology Care and the London Clinic in UK, and many more. Welcome, Dr. Sirohi, to this program. Thank you so much for joining us. We look forward to all your guidance about breast cancer. Over to you.
Thank you, Dr. Chidambaram. Thank you so much for a wonderful introduction. And as you rightly said, we actually shy away from talking about cancer. So I think this conversation is very important in increasing the chances of patients being detected early, because we know that if cancer is detected, any cancer, if it's detected early, it is highly curable. It's easier to treat and actually less expensive as well for the patients. And I feel that with early detection, the patients also have a lot of options that are available to them compared to advanced stages. And what we are seeing in developing countries, especially India, that the new cancer cases are rising. And in women, especially, it can be as high as 1 in 4 in Northeast India to 1 in 20 in women in urban India. and 1 in 60 in rural India. So I think we need to take a leaf from the book from women living in rural India. But yes, cervical cancer is more common there. The lifestyle cancers are more common in urban India, like breast cancer, colon cancer. And our health, I feel, is in our hands. So we have to proactively look after it. And just talking about this, I hope will increase awareness so that more women will come up for screening and not ignore any signs and symptoms. The one more thing I wanted to say is we just don't know why one woman gets cancer and why another woman doesn't get it. So being a woman itself is the biggest risk factor for cervix cancer and breast cancer. So I think all of us are at risk. So all of us actually need to really look after and see what we can do proactively right from the time, in our 20s and 30s to detect early and prevent as well.
So could we begin with the basics? So what is breast cancer?
So you very nicely told about what cancer is. So cancer can arise in any organ of the body. And if it arises in the breast, whether it is a lady or a man, because even men can develop breast cancer, one must not forget that. So if you have any lump in the breast, which is growing uncontrollably, a lot of us have lumpy breasts, and we have fibroadenomas or fibroadenosis. So not all lumps in the breast are cancerous. Majority actually are benign. As we get older, they shrink, and then nothing needs to be done about them unless they are causing symptoms. But one must not ignore those lumps. One must get tested to make sure that they are benign. That means they are not cancerous. And if we know they are not cancerous, one can just observe them and live with them.
So are there different types of breast cancer as such? And what do people have to know about that?
So when we do tests, so breast cancer, there are various types, and the commonest types that we talk about are ductal, which arises in the duct, and the other is the lobular cancer, which arises in the lobules, which is at the end of the duct. So these are the two major types, and the treatment is slightly different. The tests that we do are slightly different in diagnosing and treating as well. The biology of the breast cancer is different for each of these. And over the years, I would say especially over the last decade, what we have learned from a lot of clinical trials from patients that it is that the 5-year survival, it's a matrix that we look at. The cure, which is how we define the cure rates, are higher in women where the cancer is detected early. We classify the patients molecularly into various different types of cancer, whether the cancer is HER2 protein driven or hormone sensitive driven. And the long-term outcomes, prognosis, treatments are all different based on which type of cancer the patient has. Even the imaging is different depending on what type of cancer the patient has.
So as far as the person is concerned, so when should they take medical advice, as in like when they find the lump or earlier, what would be the warning signs, so to speak?
So I think I would say that, all women or men should know what is normal for them. So a self-breast examination is something, to do it the right way is very important. To do it, 5 to 6 days after your periods, once a month. Each woman and man should know what is normal for them. Because for some of us, one breast may be larger than the other, which may be completely normal. But it's important to know what's normal for you. So learn to do proper self-breast examination. At the Apollo website, we actually spent a lot of time making a video of, certifying people as breast examiners and, how you should do it in the right way. So know what is normal for you. And then if you feel that, you are looking at yourself in the mirror, the one nipple is slightly above the other one, it's not in the same line, or you see that the contour of the breast is not the way it is every day, that the contour is different. You can see a slight upturn, or you can see that your nipple is inverted. Anything that is not abnormal, you have pain, redness, swelling, one breast is suddenly become larger than the other breast, you have a lump under your arm or in your neck, you have a bloody discharge from the nipple. So anything, either it's the size, texture, contour, anything that is not normal, you must take advice. It may be just a simple infection. So a lot of pregnant women also get diagnosed with breast cancer. And, they shy away from going to a doctor, assuming that it could be something to do with breastfeeding. So if you've noticed a lump while you're breastfeeding, or if you're pregnant as well, don't ignore it. Yes, you're right. It could be nothing. It could be just something which is normal, but have it checked out. A simple ultrasound can tell you whether it's normal, abnormal, and your gynecologist or physician or oncologist may want to do some extra tests as well. But be aware of what is normal for you, and during pregnancy check your breasts regularly to see, because you will undergo a lot of changes. The breasts do become larger, but if you notice a new lump, you must get that checked out.
So what are the other methods of screening apart from the self-examination, provided that, so at what age should one start going for these screening tests, and what is done usually?
So, it's very good that we have screening tests available for breast cancer. Screening means when you diagnose something or detect something when the patient is completely normal, or each one of us, we go to a hospital and we get some tests done. We have no symptoms. So that is what screening is. And we know that screening saves lives in breast cancer. A lot of studies have been done. In fact, in Sweden, there's a huge study done with more than 50,000 women, which showed that women who do undergo screening, that means they have yearly tests, which I'll talk about, the chances of them dying from breast cancer is almost 60% less over 10 years, about 47% less over 20 years. So these are hard statistics which we must not ignore. It's a simple X-ray of the breast which is done. And yes, there are pros and cons, which we can talk about as to whether you should have an MRI, whether you should have a mammogram. But what I would suggest is that every lady from the age of 40 years onwards should actually think about at least having a mammogram. When you're younger, your breasts are dense. So mammogram, a lot of people say, may not be the right test because, if the breasts are dense. But if you have a digital mammogram with what we call digital breast tomosynthesis, then the quality of images is better. Digital means it's on a computer, so the radiologist can enlarge it and see if there are any abnormal areas. So make sure I would say between 40 and 45 years to have a digital mammogram with digital breast tomosynthesis, or an MRI breast if the breasts are dense. Above 45, I would suggest just undergo a digital breast mammogram. A lot of places in our country, it's all about equity in care as well. The UICC's theme for World Cancer Day this year. So a lot of places may not have a digital mammogram. That doesn't mean you don't have the mammogram. I think you should still have a mammogram, but make sure that that it is done once every year. So that, and a clinical exam is done by a professional as well. Self-breast exam is important, but along with that, you must also have at least once a year a checkup by a physician. The other thing I would say is some of us may have a family history of breast cancer or ovarian cancer. So in those women, the screening guidelines are that usually we start a decade before your parent or your first degree relative was diagnosed. Say your mother was diagnosed at 40 years. So from the age of 30 years, you should, or if you carry the breast cancer gene, then you should start your screening from the age of 30 years onwards. And the test recommended there is an annual MRI scan, because the mammogram, like I said, is not the right test in patients who have dense breasts.
So if it is, so when we talk about family history, what is exactly a strong family history? Is it just the first degree and the parents, or is it the maternal, paternal? So because the protocol is very different for those who have a family history, because you have to start earlier and
Yes.
they may need further genetic testings. And so who has to go for all that basically? Or is it like, because people sometimes say that, oh, but my cousin, my third cousin, second cousin, or my aunt. I mean, of course, if it's your parent or sibling, that's a different matter. So how does it work?
So we have quite good models. We call them risk prediction models, through which a genetic counselor can put all the information in and actually calculate the risk that you have of developing either breast cancer or ovarian cancer or even pancreatic cancer, which is also related to the breast cancer gene. So, I would say that if you have a relative in your family who's been diagnosed at a younger age, so especially if they've been diagnosed at less than 50 years of age, then that puts you at a slightly higher risk, and you must take any cancer. It could be colon cancer or breast cancer. Younger age cancers, you must have a discussion. So, like my grandmother had ovarian cancer in late 80s. So that would not count as family history, because if cancers are diagnosed as we get older, so that is different.
Yeah.
Usually they do not have a genetic implication. But if you have a first degree, by mean a blood relative, your father, your mother, or your paternal aunt, or your grandmother. So if you have a family history of cancers, check at what age they were diagnosed. Because I think that is very, very important. Also, if you have any type of cancer, then there are certain cancers, let's say for breast cancer, triple negative breast cancer, even if it is in 60s or 70s, it may have a genetic basis. So we counsel patients and actually send most patients with triple negative breast cancer for breast cancer gene testing. And if they carry the gene, it has an implication, of course, for their children, and also has an implication on them for their treatment as well, because we have a drug that actually targets that gene and may help them in living longer. And the other most important thing for me, I feel, is to know that you carry the gene is important, because a lot of ladies come to me and say that, when they're getting married, that, I have the BRCA1 or BRCA2 gene, but I don't want my kids to have it. So we can do something called, pre-implantation genetic diagnosis, and it's available in India now as part of oncofertility. So it's important to know your family history, and also what you can do is for the next generation, mitigate that risk. And, so that, you don't pass it on, because that's a huge guilt factor that a mother has, that, she has passed it on to her child, whether it's a male child or a female child. So I think it's important to know and then get yourself tested, see a specialist. Very important that before you do the test, you have genetic counseling. And it could be done through telegenetics. Apollo has a fantastic program of telegenetics run by Dr. Ganapati. So I think, all of these things are, I feel, educate yourself and, do something yourself. Be proactive about all these things.
Yeah, that is the thing. So, many times, even as medical professionals, sometimes we know all these things, but sometimes it seems, too much of an effort to go to a certain extent. Like, we not go the full way, but I think it's important to. So we have discussed about the screening mechanisms and even the age groups. What happens after, so till which age should people keep having the mammogram every year? And is it also that, like, for example, I know people who, had this mammogram every year, but afterwards, after about 10 years or so, they were told that, you can have you can have the ultrasound examination every year, and then you can have the mammogram every other year. So are there any set protocols, or is there any point when you stop having them, or do you keep having them forever?
So I think that's a very good question, because we are living longer. Our life expectancy has gone up in India as well. So a lot of countries that have a coordinated screening program, we don't have that in India, but countries like UK, US, Europe, they have a coordinated screening program. The minute I turned 50, when I was in London, I got a letter from my GP saying that you need to turn up for your screening mammogram, and they keep calling you till you've had the mammogram. So, so that is, you're really looked after in that system, and with universal health coverage. So they actually looked at whether we really need to invest in doing mammograms in ladies above 70. And there is a study where they enrolled patients between 45 and 50, whether you should do that or above 70. And I think one has to be just slightly pragmatic about it. I feel that after a certain age, the breasts become fatty. It's easier to feel the lumps. So self-breast exam is important. But I feel that every 2 years, if you are fit and well and healthy, doing a mammogram every 2 years is not a bad idea. It's sensible, because we are seeing a lot of women who are above 70 who are diagnosed with breast cancer. And, to have an early diagnosis where, you have detected the lump, which is very small and tiny, sometimes precancerous. Yes,
Yeah.
you may think about that, maybe it's overdiagnosis, but for that particular lady, I feel that, to have that lump diagnosed, to have breast conserving surgery and not have chemotherapy. We give chemotherapy where the risk factors are high, where the cancer is advanced. So this lady came and met me. She's 72 here in Chennai, very educated lady. And, she says, I have the mammogram. I tell all my friends to have it as well. And because she's the biggest ambassador, I feel, for it to have it, because she didn't need chemotherapy. She just had tiny lump removed, breast conserving surgery, is having radiotherapy now. That's it. And her treatment is done. She'll take one tablet for about 6-7 years. And or even 5 years she can get away with. And blood pressure, diabetes, I feel, you're on treatment forever. And nobody talks about them being a problem. So I feel that I would, if a patient is fit, hale and hearty and well, we should continue doing mammograms even after 70, every 2 years. But
we were talking about the breast MRI. So could we also talk a little bit about, are there any, because we keep reading about quite a few of these newer tools, like, there is something using molecular breast imaging, and then there is, what is the role of the PET scan in cancer, in breast cancer? Or is there, anything else like optical imaging, elastography? What is the role of all that? Or the gold standard is still the mammogram?
So I would say for an average risk individual where there's no family history, let's say, I would just do mammograms. And I would actually, if you're living in the city, try and find a place which has a digital mammogram. After the age of 50, simple digital mammogram annually is good enough. Before that, I would say that, try and have it with digital breast tomosynthesis, because it can actually look at the dense breasts as well. MRI, you rightly said, the only issue with MRI is slightly more expensive. It takes longer time. If you're claustrophobic, if the place doesn't have an open MRI, it can be an issue. But the advantages of MRI are that, it is more sensitive. That's why, we do it in patients who are younger as well, in their 30s with dense breasts. It is able to pick up areas slightly more better than mammogram. But you can't say that if a patient has something diagnosed on MRI, you still have to do a mammogram, because mammogram is the test which looks at what we call microcalcifications. So MRI will not look at that. So each one of them actually complements when you're diagnosed with breast cancer. And when you're diagnosed with breast cancer, at that time, PET scan actually is a test which scans your whole body. So MRI, mammogram is like what I say is anatomical test. It checks where the cancer is and what the size of the cancer is. PET scan is what is a functional imaging. If the cells are dividing, then they take up glucose. And so PET scan looks at your whole body and checks whether the cancer has spread anywhere. In a normal individual with no cancer, PET scan has no role to play. You should not have a PET scan. Because remember that whatever test you do, there is a negative side to it as well, because they do give you radiation. And in a lifetime, we can only have this much radiation, because radiation itself is a risk factor for cancer, for developing cancer. But with mammogram, we have looked at, a lot of studies have looked at, once a year mammogram is absolutely fine and safe. In some patients, we do it twice a year as well, but that is very rare. So, but the risks, you also have to look at the risks and the benefits. If the risks and justify the benefits, you have to go for that. With MRI, there's a new thing that has come up, which is called fast MRI or abbreviated MRI. So it is not so expensive and it takes just 10 minutes. So I think that is something where the future is, and the molecular imaging as well is thermal imaging, a lot of talk about it, but none of them has actually been better than a simple mammogram. So I would still say that, one should go for a simple X-ray of the breast. It's slightly uncomfortable. I always say some male must have designed it because, it is painful slightly, but it's like short-term pain for long-term gain is what I say.
Yes. There's also this practice of, sometimes when a lump is detected, they do a little biopsy or they do an FNAC. So what's that all about?
So I think, like I said, when we see a lump, it could be cancerous or non-cancerous, means benign. And sometimes with the imaging, we are not sure exactly what it is. So the only way we can be sure that it's cancer is by actually taking some tissue out of it. So we put a needle in and take some cells out. It's called fine needle aspirate. We are actually moving away from fine needle aspirate nowadays because we just do a biopsy where actually we take a tissue out. The reason we do that is because all these molecular tests actually help us treat the patients better. And that's why the cure rates are significantly higher now. They're in the range of 85 to 95%. And the reason is we are able to say that, this patient needs chemo first based on the molecular tests and or needs surgery first. So it actually helps us sequence the treatment for patients better by looking at the receptors in the biopsy. So we do recommend that if we suspecting cancer, that all patients undergo a biopsy. And that's what I tell all the patients, don't be in a rush to start treatment. Because when a patient comes, sometimes they want to get admitted and start treatment today. I always say that, breast cancer treatment is never an emergency. You have to really, because once we move forward, we can't move back. So you really have to think whether I do chemo first, targeted therapy first, or I do surgery first. And that decision can take about a week to 10 days sometimes. So one must wait for those results before proceeding with the treatment for cancer.
We'll now talk a bit about preventing breast cancer. So that is something which we have been hearing, that it really is also dependent on one's lifestyle. So in your experience, what should one do to, are there any tried and tested methods, or is breast cancer really preventable by practicing a good lifestyle?
So I think there are some things, I call them modifiable, not modifiable. There are some things which we can do nothing about to prevent breast cancer. That's being a woman or being getting older, or a family history, or having dense breasts. So some of us have dense breasts. That itself is a risk factor. Or a reproductive history, whether we've had a child or what age we had a baby. There's nothing we can do about it. And these are risk factors. But there are some things which are in our hand. And I think the most important out of all is exercise. Because, exercise influences the hormone levels in our body, the estrogen and progesterone. And we know that exercise, a lot of studies have been done, and they show that it reduces the breast cancer risk, not only by boosting the immune system, but by having less body fat, which actually translates into lower estrogen levels. So which actually prevents breast cancer. So, and plus, of course, it's mood boosting, anxiety, and all of cardiac, heart protective, and all of that. But I always say that if exercise were a drug, it would be packaged and marketed, like all these newer devices or genomic tests. So exercise, I feel, is the most important factor because it keeps your weight down, keeps the fat content in your body down. And the type of exercise is something which makes your heart rate go up, which is cardio, like 30 minutes a week, 30 minutes a day. is very important. And I think it's important you give yourself that much time, self-breast examine and exercise. The others to prevent is, I have this ABCD. A is avoid alcohol, tobacco, smoking, oral contraceptive pill, hormone replacement therapy for a long time, and processed foods. B is for be breast aware, breastfeed for at least for breast cancer. And I always also add be vaccinated for, hepatitis B, which prevents liver cancer, and HPV, which prevents cervical cancer. 80% of cervical cancer is prevented by this vaccine. And countries have eradicated cervical cancer because they've eradicated HPV. So this is something we need to really, really think about. C is for calm. We know that the whole of the West is moving towards the East with yoga, meditation. So all of this will decrease the stress level. So C is for calm. D is diet, having a good diet, which is less in trans fats, enough vegetables and fruit. And there are a lot of studies which have shown that the risk of developing breast cancer and colon cancer is strongly linked to the diet you take. Yes. E is for exercise, F is for know your family history, and S is for sleep and screening. Screening we've already touched about, but sleep is, there was a study in Spain which showed that, if you sleep before 9 p.m. or if you have 2 hours between your last meal and sleep, your risk of breast cancer is 25% less. So it used to be called a shift-based cancer, because more of nurses and people who are doing shifts were developing breast and prostate cancer. Because I think it messes up with your hormone levels in your body. So I think these are all things which are completely in our hands. It's trying to have the last meal at 7 and then not going to sleep at 9 p.m. is something which our grandmothers used to talk about.
Yes, but which we have kind of lost.
We've kind of lost, yeah. They used to get up before sunrise and go to bed by 8:39. So all of those things were, I think, the right.
Yeah. Is there anything else that you would like to say before we conclude our session?
So I just feel that we are living in COVID times, and I feel that most of the patients I'm seeing in my clinic, especially ladies with breast cancer, educated women, they're coming with wounds that are smelling, which are growing. They have lymph glands, a lump in their neck. They've had the breast lump, but they don't want to worry the children or don't want to worry their husbands or whoever. They don't want to prioritize themselves. So they're ignoring it. So I just feel, I just saw a patient with gallbladder cancer has come with deep jaundice, but and pain when he's bedbound, they've come. So they're untreatable. And if they had come 6 months ago, 3 months ago, maybe they were not only treatable, but curable. So what I'm saying is, don't let the fear of COVID be counterproductive. Come to the hospitals. Hospitals are safe places. We have done a lot of things to make sure that this is a safe environment for you. And the Apollo staff, has been amazing in, making sure. And I'm sure all the other hospitals across the country are taking the same precautions so that, you come and get yourself checked out.
Absolutely. Thank you so much, Dr. Bhawna Sirohi. And dear
Thank
viewers,
you, Dr. Chidambaram. You've been amazing. Thank you.
You too, doctor. So I hope viewers, you've had a very informative session on the risks and screening for breast cancer. But let this not make you anxious or scare you. Instead, be alert to your body and attuned to it. Take full advantage of the amazing advances in medical technology and in medicine to screen yourself, to know your risk, to know your family risk, to avail of the latest treatments. Remember that the earlier you find out, the better the chances are that you can conquer cancer. So till we meet again, stay safe, stay healthy, follow us and reach out to us through any of our digital platforms. We're always there to support and help you. See you soon. Thank you and namaste.
Thank you.